So this is a study that was presented by my colleague Gloria Iacoboni, and it includes more than 500 patients treated in several European institutions with lymphoma treated with CAR T-cell therapies. And what we did is look at specifically the impact of extranodal involvement, because it has been reported that patients with extranodal disease do poorly after CAR T-cells. But we observed that patients with isolated extranodal involvement actually did quite well, similar to patients with nodal involvement, and were those with extranodal and nodal involvement the ones who did worse than the other two groups. We also observed that as the number of extranodal sites increases, the probability of long-term survival decreased. Finally, we wanted to look at particular sites, and we observed that there were some sites in which CAR T-cells worked worse, specifically liver involvement and adrenal glands. The patients who had this involvement at the time of CAR T-cells were more likely to have worse outcomes after the procedure. And finally, we observed a trend to a more frequent extranodal involvement at relapse after CAR T compared to CAR T. So there were a third of the patients who only had nodal involvement at the time of treatment who had extranodal at relapse.